So a herniated disc is like a cushion or a shock absorber between the bones of your spine that moves out of its normal position. It's important to understand what a disc is. A disc is like a gelatinous type structure, if you will, to put it in layman's terms, that sits between the bones of your vertebrae. And that could be in the cervical, which is the neck, the thoracic, which is the mid-back, or in the lumbar spine, which is the lower back. And if a portion of that disc, usually the central portion of that disc, moves out of its normal position, it can sort of pinch a nerve. You may have heard terms like slip disc, pinch nerve. They're usually referring to very similar situations in which the nerve is irritated, and a patient could present with, let's say, if it's in the neck, neck pain and or symptoms down into the arm, or in the lower back, pain in the lower back radiating into either of the legs or both of the legs. It's important to understand what the patient's history and presenting symptoms are, and typically a herniated disc can be made after gathering the patient's history, doing a physical examination, and diagnosing the condition on an MRI.